Over 460 million people worldwide live with diabetes. This staggering number includes individuals from all walks of life, affecting diverse communities globally. This number is projected to reach over 700 million by 2045. The rapid increase in diabetes cases highlights the urgent need for effective solutions and preventive measures. Approximately 5 to 10% of these cases are type 1 diabetes, or T1D. Despite being a smaller percentage, the impact of T1D on individuals and healthcare systems is profound. T1D is a chronic autoimmune disease. It is not caused by lifestyle factors but by the body's immune system mistakenly attacking its own cells. It occurs when the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. This destruction leads to a lifelong dependency on insulin therapy. This leads to a deficiency of insulin, a hormone essential for regulating blood sugar levels. Without sufficient insulin, blood sugar levels can become dangerously high. The rising prevalence of T1D poses a significant global health challenge. It requires comprehensive strategies to manage and mitigate its impact on affected individuals. It necessitates ongoing research and development of effective treatment options. Scientists and medical professionals are tirelessly working to find innovative solutions. Among these potential solutions, pancreas transplantation has emerged as a viable option. This procedure can restore insulin production and offer a new lease on life for T1D patients. This holds the potential to transform the lives of individuals living with T1D. With continued advancements, we move closer to a future where T1D can be effectively managed or even cured. Imagine a life where your body wages war against itself. Every day is a battle, a constant struggle to maintain balance and health. That's the reality for individuals with type 1 diabetes, or T1D. From young children to adults, this condition spares no age group. Their immune systems mistakenly target and destroy the insulin-producing cells in the pancreas. This autoimmune response is relentless and unforgiving. Insulin acts like a key, unlocking cells to allow glucose or sugar from the bloodstream to enter and provide energy. Without this key, the body cannot access the fuel it needs. Without insulin, glucose builds up in the bloodstream, leading to hyperglycemia or high blood sugar. This condition can be dangerous if not managed properly. This can cause various short-term complications such as frequent urination, excessive thirst, fatigue, and blurred vision. These symptoms can be debilitating and affect daily life. Long-term, uncontrolled hyperglycemia can damage blood vessels and nerves, leading to serious complications like heart disease, stroke, kidney failure, blindness, and nerve damage. These complications can be life-threatening and require extensive medical care. Living with T1D requires constant vigilance. Individuals must be proactive in their health management, often checking their blood sugar levels multiple times a day. They must carefully monitor their blood sugar levels throughout the day, using tools like finger prick tests and continuous glucose monitors. To manage their condition, they administer insulin injections or use an insulin pump. This process is crucial for maintaining their health and preventing complications. They also need to make careful dietary choices and engage in regular physical activity. A balanced diet and exercise routine are essential for managing blood sugar levels and overall well-being. A pancreas transplant offers a potential cure for T1D. It involves surgically placing a healthy pancreas from a deceased donor into the recipient's body. The transplanted pancreas can then produce insulin, eliminating the need for external insulin injections or pumps. Pancreas transplants are complex procedures. They are typically reserved for individuals with severe T1D who experience frequent and difficult-to-manage episodes of low blood sugar or hypoglycemia. These episodes can be life-threatening and significantly impact quality of life. How do you think a pancreas transplant could change the daily life of someone with type 1 diabetes? Drop your opinions in the comments. The path to a pancreas transplant is not easy. It begins with a comprehensive evaluation process to determine if a candidate is eligible for the procedure. Eligibility criteria are strict and vary depending on the transplant center. Generally, candidates must have end-stage diabetes complications or severe hypoglycemia unawareness. They need to be in overall good health to withstand the surgery and tolerate the lifelong immunosuppressive medications required to prevent organ rejection. The evaluation process involves various tests and consultations with a multidisciplinary team of healthcare professionals. Hey, are you enjoying the video so far? If you are, give it a thumbs up and hit that subscribe button. It really helps the channel grow and keeps us motivated to create more awesome content just for you. Don't forget to tap the bell so you're always the first to know when new videos drop. A complex procedure, the pancreas transplant operation. A pancreas transplant is a major surgical procedure that typically lasts several hours. It involves two surgical teams, one for procuring the pancreas from the deceased donor, and another for transplanting it into the recipient. During the surgery, the surgeon connects the donor pancreas to the recipient's blood vessels and small intestine. The recipient's own pancreas is usually left in place. After the surgery, the recipient spends several days in the intensive care unit for close monitoring. A life after transplant, managing rejection and complications. Following a pancreas transplant, recipients must take immunosuppressive medications for the rest of their lives. These medications prevent the body from rejecting the transplanted organ. However, they suppress the immune system, making the recipient more susceptible to infections and other complications. Regular follow-up appointments with the transplant team are crucial. These appointments monitor the function of the transplanted pancreas and manage any potential complications. Lifestyle modifications, including a healthy diet, regular exercise, and avoiding smoking and excessive alcohol consumption, are essential for long-term success. Success rates and long-term outcomes. A balanced perspective. Pancreas transplantation has shown promising results in improving the lives of individuals with type 1 diabetes. According to the United Network for Organ Sharing, the one-year survival rate for pancreas transplants is over 85%, and the 5-year survival rate is over 75%. However, it's essential to acknowledge that pancreas transplantation is not without risks. Complications can include organ rejection, surgical complications, infections, and side effects from immunosuppressive medications. With a 75% 5-year survival rate, do you think pancreas transplants are a good long-term solution for type 1 diabetes? Drop your opinions below. The future of type 1 diabetes treatment beyond transplantation. While pancreas transplantation offers hope, it is not a perfect solution. The procedure is complex, and there are significant risks involved, including the possibility of organ rejection and the need for lifelong immunosuppressive drugs. These factors make it a less than ideal option for many patients. Researchers are actively exploring alternative approaches to cure or better manage type 1 diabetes. The goal is to find solutions that are less invasive and more sustainable in the long term. These include islet cell transplantation, which involves transplanting only the insulin-producing islet cells from a donor pancreas. This method aims to reduce the risks associated with full organ transplants and improve the quality of life for patients. Stem cell therapy, where scientists are exploring ways to generate new insulin-producing beta cells from stem cells. This innovative approach could potentially provide a renewable source of healthy cells for patients. Immunotherapy, which aims to retrain the immune system to stop attacking beta cells. By addressing the root cause of type 1 diabetes, this method could offer a more permanent solution. And artificial pancreas technology, which combines a continuous glucose monitor with an insulin pump to automatically regulate blood sugar levels. This technology aims to mimic the natural functions of a healthy pancreas, providing better glucose control and reducing the burden of daily management. These research efforts hold immense promise for the future of type 1 diabetes treatment. The advancements being made in these areas could revolutionize how the disease is managed and potentially lead to a cure. They offer hope for a cure or the development of less invasive and more effective management strategies. With continued research and innovation, the future looks brighter for those living with type 1 diabetes. Conclusion: a step towards a cure? Pancreas transplantation can be a life-changing procedure for individuals with type 1 diabetes. It offers freedom from insulin injections and the potential to live a healthier life. However, it is a complex decision with potential risks and benefits that must be carefully considered. While not a cure, pancreas transplantation represents a significant advancement in type 1 diabetes treatment. Ongoing research and the development of novel therapies offer hope for a future where type 1 diabetes is no longer a chronic, life-altering condition. Thanks for watching till the end. If you enjoyed the video, make sure to like and subscribe to the channel. Your support means everything, and it helps us keep bringing you more great content. Don't forget to turn on notifications so you never miss a video. I can't wait to see you in the next one.